Hello everyone. Today we will discuss about the insulin hormone, how it works. Insulin is a hormone that comes from the pancreas, a gland located behind and below the stomach. Insulin control how the body uses the sugar in the following ways. The sugar in the bloodstream triggered the pancreas to release insulin. Insulin circulates in the bloodstream, enabling sugar to enter the cells. The amount of sugar in the bloodstream drops. In response to this drop, the pancreas releases less insulin. The role of glucose. Glucose or sugar is a main source of energy for the cells that makes up muscles and other tissues. The use and regulation of glucose include the followings. Glucose comes from two major sources, food and the liver. Glucose is absorbed into the bloodstream where it enters cells with the help of insulin. The liver stores and makes glucose. When glucose levels are low, the liver breaks down stored glycogen into glucose to keep the body's glucose level within a healthy range. In type 2 diabetes, this process doesn't work well. Instead of moving into the cells, sugar builds up in the blood. As blood sugar level rise, the pancreas releases more insulin. Eventually, the cells in the pancreas that makes insulin become damaged and can't make enough insulin to meet the body's needs. What are the risk factors? Factors that may increase the risk of type 2 diabetes include weight, being overweight or obese is the main risk. Fat distribution, storing fat mainly in the abdomen rather than the hips and thighs indicate a greater risk. The risk of type 2 diabetes is higher in men with a waist circumference above 40 inches and in women with a waist measurement above 35 inches. Inactivity. The less active a person is, the greater the risk. Physical activity help control weight, uses up glucose as energy and makes cells more sensitive to insulin. Family history. An individual risk of type 2 diabetes increase is a parent or sibling has type 2 diabetes. Race and ethnicity. Blood lipid levels. An increased risk is associated with the low level of high density lipoprotein, that is HDL cholesterol, the good cholesterol and high level of triglycerides. Is the risk factor of type 2 diabetes increase with age, especially after age 35. Prediabetes. Prediabetes is a condition in which the blood sugar is higher than normal but not high enough to be classified as diabetes. Left untreated, prediabetes often progresses to type 2 diabetes. Pregnancy related risk. The risk of developing type 2 diabetes is higher in people who has gestational diabetes when They were pregnant in those who gave birth to baby weighing more 9 pounds. Polycystic ovary syndrome. Having polycystic ovary syndrome, a condition characterized by irregular menstrual period, excess hair growth, and obesity, increase the risk of diabetes. What are the complications? Type 2 diabetes affect many major organs, including the heart, blood vessels, nerves, eyes, and kidney. Also, factors that increase the risk of diabetes are risk factor for other serious diseases. Managing diabetes and controlling blood sugar can lower the risk of these complications and other medical conditions, including heart and blood vessels disease. Diabetes is associated with an increased risk of heart disease, stroke, high blood pressure, and narrowing of blood vessels, a condition that called atherosclerosis. Nerve damage in limbs. This condition is called neuropathy. High blood sugar over time can damage or destroy nerves. That may result in tingling, numbness, burning, pain, eventual loss of feeling that usually begin at the tips of the toes or finger and gradually spreads upwards. Other nerves damage. Damage to nerves of the heart can contribute to irregular heart rhythms. Nerve damage in a digestive system can cause problem with nausea, vomiting, diarrhea, or constipation. Nerve damage also may cause erectile dysfunction. Kidney disease. Diabetes may lead to chronic kidney disease or end-stage kidney disease that can't be reversed, that may require dialysis or kidney transplant. Eye damage. Diabetes increases the risk of serious eye disease such as cataracts and glaucoma, may damage the blood vessels of retina, potentially leading to blindness. Skin condition. Diabetes may risk some skin problems include bacterial and fungal infection. Slow healing. Slow healing left untreated, cuts and blisters can become serious infection which may heal poorly. Severe damage might require toe, foot or leg amputation. Hearing impairment. Hearing problems are more common in people with diabetes. Sleep apnea. Obstructive sleep apnea is common in people living with type 2 diabetes. Obesity may be the main contributing factor to both conditions. Dementia. Type 2 diabetes seems to increase the risk of Alzheimer's disease and other disorders that cause dementia. Poor control of blood sugar is linked to a more rapid decline in memory and other thinking skill. Prevention. Healthy lifestyle choice can help prevent type 2 diabetes. If you have received a diagnosis of prediabetes, lifestyle changes may slow or stop the progression to diabetes. A healthy lifestyle include eating healthy food. Choose food lower in fat and calories and higher in fibers. Focus on fruits, vegetables and whole grain diet. Getting active. Aim of 150 or more minutes a week of moderate to vigorous aerobic activity such as brisk walk, bicycling, running, or swimming. Losing weight. If you are overweight, losing a modest amount of weight and keeping it off may delay the progression may pre-diabetic of type 2 diabetes. If you have pre-diabetes, losing 7% to 10% of your body weight may reduce the risk of diabetes. Avoiding long stretches of inactivity. Sitting still for a long period of time can increase the risk of type 2 diabetes. Try to get up every 30 minutes and move around for at least a few minutes. For people with pre-diabetes, metformin, diabetes medication may be prescribed to reduce the risk of type 2 diabetes. This is usually prescribed for older adults who are obese and unable to lower blood sugar level with lifestyle changes. Thank you so much.